That was, a pitch perfect introduction to a day and a workshop that has been designed to go deeper and to move into an understanding of what it takes for many, many more of us to do this work, right? Following this electrifying emotional encounter with like legends of this work, we're going to continue the dialogue in ways that help many, many more of us find our own roles in building power. One of the unanswered questions in the Q&A here has been that it feels like such an opportunity to cement new narratives, to change systems, but that opportunity itself can feel very daunting to people because it doesn't seem like there's enough buy-in. And how do we do the hard, healthy work of affirming human value and agency in the ways that we just heard and incorporate it as a routine, a norm in the everyday, sort of everyday routine and everyday walk of life for all of us. None of us are experts in this, but we have expertise to bring and to share, and really the rest of this workshop is built for that. This particular session is an opportunity to talk with two colleagues who between them have 70 years of experience working at the interface of population health and civic life, the place where people's power to shape a common world and their own lives and livelihoods comes into focus. So it's my pleasure to introduce Richard Healey, the senior advisor to the Grassroots Policy Project, which he had founded in 1994. The Grassroots Policy Project is focused on long-term strategies for transformative change, in particular on power, ideology, and movement infrastructure. He's also the chair of the board of the Commonwealth Foundation. We also have Jonathan Heller, recently joined the Population Health Institute at the University of Wisconsin as a senior health equity fellow. He's also the co-founder and until this year, or last year, was the co-director of Human Impact Partners, a national nonprofit focused on bridging power of public health to the movement for a just society. I also neglected to introduce myself. I'm Bobby Milstein, director of ReThink of System Strategy at ReThink Health and the Ripple Foundation, and a member of the Population Health Roundtable. I'll just also say that we're going to have an informal dialogue marked by storytelling and observations, but we want to hear from you. So please share your questions now and along the way. We'll do our best to steer this conversation where you want it to go. The key word for this entire workshop is power, right? A word that is notorious for wobbly definitions and even outright discomfort in the classical sort of detached discourse of health science. But we know that it is possible to bring this down to realistic, pragmatic experience of what does it actually take to build the power that's necessary to change the circumstances and courses of our lives together. We've seen examples of that in our two first speakers, and now we want to sort of unpack what does that power building entail. Now, Richard, I want to begin with you because you've written famously about three faces of power, right? There's power over, there's power with, and there's power to do things. Folks have a link in the readings and resources to that document, but could you just share a little bit to begin with how you came to draw these distinctions of different faces of power and how you've come face to face with them in your career?
Thanks, Bobby. I will. I also want to thank Aijin and Latasha for just an extraordinary opening, and Tony Eiton, who has been doing this work for so long. I moved to Chicago in 1971, having already been an activist for a number of years. It was the ground zero for the new community organizing. Community organizing is tough. And to succeed, people had to do two things. They had to organize people and they had to organize money. And out of that necessity, they defined power. Right out of the real world, they defined power as organizing people and organizing money. But it was local, and though many of them were aware of the kind of issues that Aijin and Latasha Brown were just talking about structural racism, the social determinants of health, though they wouldn't have used those words. They were struggling to work with 4 or 5 staff people and hold on to people and win a local campaign and ameliorate conditions for their folks. So the notion of power as narrative, which was the last big topic in the previous session, as late as 10 years ago, people to threaten to kick me out of community organizing meetings when I wanted to talk about power as narrative, power as ideology, power as storytelling, because that didn't seem practical. The definitions of power, there's no one definition, and that's fine. Our interest was in how to expand the notion of power in ways that would let community groups, networks, community groups expand their tools to create the kind of thing that IGEN has created over the last 10 years, so that the power of narrative became a part of the definition. The power of building major alliances, durable alliances, became part of the definition of power, as opposed to only organizing people locally and organizing money locally. So the notion of what is power relates to the tools you have to change our society.
Yeah, it's a great observation here, because taking these concepts and pragmatizing them into practice is really one of the things that both of you have done throughout your careers. And Jonathan, Richard's given us a way to listen for these different phases of power, but what's been your experience about when and how do health professionals create space to even think about this and then roll up their sleeves and figure out ways to go about building it?
Yeah, well, first, let me thank everybody who's talked before. IGEN and Latasha are super inspirational. And frankly, what I've been doing for the last 15 years is trying to figure out how to bring the field of health and public health into this work that they're doing and to community organizing and social justice. The way I think about it, the framework that I use is that we have now started talking about health inequities extensively in public health, and over the last few years, it's really become a prominent theme, a prominent narrative, whereas 15 years ago we weren't really talking about it very much. But how do health inequities translate into power? Why do we need to think about power? Well, health inequities, as we all know, are caused by, to a large extent, inequities in the social determinants of health, right? And inequities in housing and access to the vote, in income, as IGEN was talking about. But if you think about who is facing inequities and all those different social determinants of health, it's all the same populations, right? Low-income people of color, generally. And why is that the case? Why do we have inequities across all of those things? It's because we have power imbalances and because we have a lot of forms of oppression that are really dominant. And so if we actually want to advance health equity, I think we need to, it's clear that we need to address these power imbalances. And so by working with community organizing groups like the National Domestic Workers Alliance and local groups like those, that's how we in public health can actually address the issues they care about, center their voices, and help them build power in order to overcome the issues that they are prioritizing.
Excellent, thank you. Let's maybe get a little bit more situational about this. I mean, you've laid out a nice vocabulary for thinking about why it matters and the different dimensions of power building. But let's help get into stories about how do we spot opportunities for doing it? Under what circumstances? What are the circumstances that brought you into this work? You're both doctorally trained scholars, applied methodologists. How did you move your careers over time to get on the path where power building matters and is sort of brought to the foreground as it is here today?
Well, I'll jump in. Sure. Yeah, I'm the senior one here, so I'll jump in. Well, I got into this basically. I was the third generation of a family that had been doing it since they escaped Hungary in the last century and a half ago to come to this country. So I had been an activist basically since birth. But in thinking about power, let me count the ways. So for example, I was at one point an epidemiologist for the state of Massachusetts, and really trying to look at the environmental causes of chronic diseases. That meant going to a place like Woburn or Canton or Ponkapong Pond, and looking at what was going on in the communities there. And I had to think about power because, in fact, they were state senators and corporations that said, attacked me and the community as saying, if you discuss the environmental causes of cancer, for example, in this area, you'll drive down property values, and that's not permissible. Well, how did you rally a community to both understand that and fight, both with legal, with policy, but mostly the forms of power? And a message that said, as Ai-jen and Latasha said, it's people that matter. How do you center the people in those communities, not the property values? So we often lost those fights, but over time, thanks to the work of various people, including Jonathan and you, Bobby, and Tony Eiten, we've done better. But it's by slowly developing the tools of power so that it's not an isolated community working on its own in their own community, fighting forces much larger than themselves, but in fact, fighting in statewide alliances, legislatively, politically, using tools that keep getting more sophisticated.
Yeah, I mean, what I'm hearing, I'll just reflect back, is that behind an environmental crisis, behind a housing crisis, behind any dimension of a health crisis, there's a power crisis, right? There's a story about who made the decisions, who set up those circumstances, and what is it going to take to do the hard, healthy work of changing it when some people may not see the need or might actively resist the prospects of making room for everybody to thrive, right? That's sort of what I'm hearing. And so, Jonathan, what are some of those early circumstances that sort of set you on a path where you could constantly look for those dimensions of power, even in moments when people were, contending with the manifestation of it as a health problem?
Yeah, well, I have a different history, a wandering history. I only started this work 15 years ago. Previous to that, I had actually been in biotech. My PhD is in biophysics, so really hard sciences. And I left biotech because it really didn't feel like I was living my values, that I didn't feel like the work I had got. I moved into health because of things like malaria. I'd been in the Peace Corps and I witnessed a lot of malaria, and biotech wasn't solving those problems. And so I moved into public health looking for solutions, thinking that I could bring a lens of data to these problems, and naively thinking that if I just did reports like health impact assessments and brought data to decision makers, they would change their minds. And lo and behold, more data doesn't actually change things. So, but the first project that I did as a volunteer 15 years ago was with community organizers in West Oakland, environmental justice advocates, who were concerned about a low-income housing development that was being proposed in West Oakland, right by the port, right by the freeways, where they knew that the seniors who were going to move in there were going to be exposed to pollution and noise and all sorts of other problems. And so we went through a really short process, I'd say three-month process where we had probably 5 community meetings. The organizers brought folks to the table, and we sat there and we talked about what are the issues that this development would lead to. And we produced a 10-page letter that talked about the health impacts of putting a senior housing development, low-income senior housing development right by the freeway, right by the port. We sent that to the developer, and full of good data and stories from the community, and it didn't do anything. The developer ignored us, right? But then somebody in the group had a relationship with somebody on the city council, and in particular in the planning agencies. And when there was a meeting, a council meeting around this development, we'd sent the report to that person, who happened to be from the nurses union, and they asked the developer to work with us. So it wasn't the data that necessarily changed anything, it was the relationship with the data that actually changed things. And that led to the developer actually changing their plans and all sorts of other changes in Oakland, and helped the Alameda County Public Health Department, in fact. And so really it was power, the relationships and the power there that shifted things. And later, after reading Richard's Three Faces of Power paper, I really came to understand that power was really what we were trying to change. That was fundamentally behind all of this stuff that we were doing, whether it was housing or incarceration or immigration or any of the topics we were working on, that fundamentally there was a shift in power that needed to happen, and that health could be part of that, along with community organizing.
That story does such a nice job bringing together why power marries with issues of equity and justice, right? Because the key issue is the initial attempt to sort of elevate the problem was met by, they ignored us, right? That was your phrase. The tendency to ignore people that you devalue has to be met with a response to gain dignity and respect in all the ways that Latasha and Ai-jen were talking about. The first step in any kind of move to improve health has to be rooted in the dignity and the inclusion of those people. You can't meet it with ignoring. So how have you seen sort of circumstances where people who've been ignored or oppressed actually find ways of being respected, of gaining the dignity that they deserve in the eyes of others who maybe never saw them or did value them?
Well, I would think of the first time I encountered working for a living wage for people who worked in hotels, the service staff there, many of whom had internalized the sense that because the market rated them lowly, they were paid low wages, and therefore they weren't worth much, because that is what the dominant neoliberal ideology, the dominant neoliberal narrative said, that you're worth what you're paid. If I'm not paid much, I must not be worth much. So part of the struggle of organizing workers, low-wage workers, and this is, of course, Ai-jen knows 10 times more than me and has done it so successfully, but the starting point is always the same. How do you help work with those folks to say, you are worth as much as Bill Gates, right? You are a human being, and all human beings should have this value. And how do you do it both with the people involved, and how do you find allies who validate that? People in the, ministers, city councilors, and others, so that you have both the low wage workers and validators outside, public health being a great example of potential validators, who start to say, yes, we have a right to earn a living wage, a decent wage, and understanding the importance of the narrative there, that the narrative in this country for so long is so dominant that you're only worth what you're paid. If you're paid, if you've lost out in the market, then you're a loser, and it must be your fault. Why didn't you get more education, right? Why didn't you get trained up? As opposed to, of course you're worth, right? $15 an hour or more. Why are your kids not worth, necessarily getting good child care? So that struggle of political condition and internalized dominant narrative is a crucial piece of this puzzle.
Jonathan, what does that bring up for you?
I totally agree with what Richard's saying. I'll make it really concrete in the way we were doing it at Human Impact Partners, and we continue to do this kind of thing. We approach community organizing groups and offer to work with them on the issues that they're focused on. Community organizing groups prioritize their issues based on their members. And so if their members are concerned with housing, then they try and work on, rent issues or whatever it is, right? And so we're coming to them offering to work on the issues that their members are facing, that their members are concerned about. And then rather than come in and tell them, hey, here's why you should care about housing from a health perspective, we listen to them and we consider their views, and we understand that the research around housing and health, which we have access to, is fabulous, and it's been growing over the last 20 years, but it's also limited by our view of science and everything. And so we also take into consideration their views of things and use their information as real data and science as well. Things like critical race theory, were raised in conversations we had in Minnesota around access to education and what research there was, and how limited that was in terms of describing people's experience. And so we brought in these other pieces that were missing from the literature. And we include all of that in the reports we wrote, and not only that data, but also community voice. And so by helping people see that the information that they have, that their real life experience is worth putting into a report, is another way of lifting that kind of those kinds of values up. And then finally, once we issue a report, we work with the community to help them be the conveyors of that information. We empower them to take the report and do the advocacy, to their city councils or their state legislators or whoever it is. And again, the whole process is focused on, validating the community concerns and bringing their voices together and helping them build their power to take on these issues that are affecting their lives.
I'm really getting the sense that there is a shift or an evolution in the means by which we seek knowledge, and for what purposes really does have to change if the goal is to lift up people's dignity and equip people with the power to be able to be recognized and to change the circumstances of our lives together. But those methods are really hard to do, and sometimes we have to be pioneers in developing them. And I'm wondering if you've had sort of teachers or sort of influences that you carry with you who've taught you what it means to think and act and sort of practice science in ways that really are about human dignity and about sort of maintaining that narrative of people's agency, even in the work of pursuing curiosity and questions. Who are some of your influences and teachers that you carry with you in this work?
Well, I would start with my family, who were activists and radicals all of their lives. If I had to single out one person whose work I read and listened to, it would be a man named Stuart Hall from Jamaica, who I think is the single greatest theorist of narrative and cultural strategies in the last 50 years. Let me give you an example of what I mean by that in terms of public health. This dominant narrative that we've been talking about, one of its aspects, as we know, is white supremacy. That's highly tied to this question of individualism, that it's not, there's no such thing as collective struggles. It's what can I get for myself? How can I do it? I'm competing with everybody. And one of the ways that shows up is in health. How can I improve my health care? Socialized medicine, God forbid, this is a terrible idea. The dominant narrative would say that it actually can't possibly work, right? And what that has meant over the last decades is, of course, the devaluation of public health, along with other public agencies. And the relationship, therefore, but you get health if you can afford it. Who's left out? Who's excluded? Poor people, particularly people of color. Look at the health conditions on the reservations for indigenous people, right? So a narrative that marries race and individualism together shows up around public health versus private health in just terrible ways. How we collectively then start to have another narrative, how all the community groups, how public health groups, how trade unions, how we start to talk together, it is a very tough process, right? Instead of just focusing on my own individual issue, my own particular concern, how do I make sure that my narrative, my organization's narrative, somehow tackles questions of white supremacy and individualism? And I think health, public health, is a particularly privileged area in which to do that.
That's great.
Yeah. I was lucky enough to have a lot of mentors, including Richard. Richard really taught me a lot about power, so it's fun to be on this panel with him. The framework that he set really changed the way I thought about all this stuff. I'd actually been exposed to ideas of power from quite a number of people, but I was actually kind of dismissive of it because I don't think I fully understood what it meant and what to do with it. I'll go back to lauding the Three Faces of Power framework and the ideas there. And so really I guess my grandfather is Stuart Hall in this. I was also lucky enough early on to get put into a relationship with community organizers, Deepak Bhargava from Community Change, Doran Schrantz from Isaiah, and others. And I got organized. Like they were the ones who helped me see the world from this perspective. Like I said, I came out of hard sciences. This was not a perspective that I knew or appreciated, and through conversations with them, through real projects, hard work with them, where we were trying to apply public health ideas to the work that they were doing. We built off of other I would say parents in this field, like Tony Iton, who has written about this stuff a lot, Jean Ayers, and many others who have been trying to push health equity for a number of years. So kind of taking those ideas, melding them with the community organizing ideas, taking stuff from Richard and about power and others, and that became kind of my analysis of the world and kind of the way we started work at Human Impact Partners, and a continuation now in terms of what I'm doing at the University of Wisconsin.
So I really appreciate your acknowledging the feeling of sometimes dismissing this and not necessarily knowing what it means or its gravity. Clearly individuals can come to see this as an important part of their own practice, but what does it take to start getting institutions to really start to value this, so that it's not dependent on individual, sort of personal transformation only? We've got methodologies like community engaged research and obviously health impact assessment. Richard, you've been speaking about the pivotal role of organizers as in some ways mediating the relationships that are necessary to get change happening. So can you speak a little bit about how the insights around the importance of power can start to migrate to become institutional priorities as well, in the ways that institutions start doing business?
Yeah, it's exactly the right kind of question, Bobby, because how an organization understands how it can build its power, the definition it's using, tell you where it's going to put its resources. If it puts all its resources into only building its own work in a very internal sort of way, it may be effective for the organization. But one of the things that we're suggesting in terms of this, the three faces of power that Jonathan has mentioned, that we spent so much time on it at the Grassroots Policy Project, is, for example, can organizations put resources into building deeper, more powerful alliances, in a sense, organizing other organizations? And an example, I've worked on several projects of trying to link community organizers with local health departments. And it's a hard job. They have different specific missions, different internal cultures. Community health departments, state health departments, they answer to the mayor, to the city council. They have constraints on them. Their mission, immediate mission, is different than the immediate mission of a community organization. How do you get below that to the kind of deeper issues that Latasha was talking about, that Aijen was talking about? How do you put the resources into it? How do you make the decision to put the resources into it to build the relationship between those two different kind of organizations? So you're building a larger institution. You're building what we would call an infrastructure that its pieces are doing slightly different things, but they're united around this sense of we're building a different kind of society. So that's the operative question. How do you decide in an institution to put resources into this broader mission?
So I want to build right off of there, because that's exactly the kind of work that we started doing about 3-ish years ago at Human Impact Partners, funded by Tony and the California Endowment. We were interested in bringing public health departments together with community organizing groups to have them work together. And so we started a pilot program with 5 health departments here in California. Basically did a little bit of matchmaking. Some of them had a little bit of prior relationship, but we chose a community organizing group within a county and brought them together with the county health department, where the county health department was agreeing to work on the issue that the community organizing group was focused on, to help them build power. And the community organizing group was basically promising to work with the health department and bring a health lens to the work that they were doing. And so over the course of a year, we started by building relationships, and that was really crucial, right? These groups speak different languages. They think about ideas differently. They have, as Richard said, different missions. And so fundamental to doing this work together was building relationships. And we started with a 1-day meeting, 2-day meeting really here up in Oakland. And we had all this programming. I remember probably the best piece of it was that one of the health departments, the Santa Barbara Health Department, and their community partner, Cause, went out to dinner after the first day. And that dinner was actually where they shared food, was actually where they started building those relationships. And they came back the next morning in a very different place because they had that experience and actually ended up having breakfast that day together as well. That led to really some amazing work where, and for example, in Santa Barbara, they were working on the issue of that Cause was focused on, that Cause's members were caring about, which was farm workers. That's their base. They didn't have access to toilets in the fields that they were working in. And, that's a very basic fundamental health issue, but the two of them worked on that over the course of a year and made progress and built relationships, and then, used the power of the health department to raise this as an important issue in the county. I want to just say that fast forward a little bit, those relationships with farm workers, the organizing groups that were working with the farm workers, many undocumented folks, have really helped during COVID, right? Where we're hearing many issues with undocumented folks not knowing what to do and not having, having the trust of the health department, not feeling trust in the health department. Well, I think what I'm hearing is that that's different now in Santa Barbara because of these kinds of relationships. And so I'm hopeful that COVID hasn't been quite as bad in the undocumented farm worker community in Santa Barbara because of those kinds of relationships.
Bobby, can I just add one more point onto what we're talking about here? Because I'm saying it's a decision to put resources into that, to have a dinner together, right? To do the work of translation. All of our organizations are strapped for resources. Community groups are always scrapping for money, for staff time, how to use staff best. And so Tony Eiten, who's on this call, and the role he's played in philanthropy, what was mentioned in the last session, to give some extra resources I know the community organizing side better at this point, to give some resources to them so that a staff person is freed up to have a Jonathan Heller and Human Impact Partners, or someone like you, Bobby, right? Spend time with a local health department, spend time with legislators to make sure that when the health department does something controversial in the community, that there are people to defend them. So it's not just a one-to-one relationship between the organization, but freeing up resources so that the community organization or the trade union, right, that's organizing low-income workers, also is working with the health department and with legislators so that everyone has the space and the security to know that they're not going to get attacked, they're not going to get fired to do this work. And so philanthropy has a very important role to play on at least the community organizing side in freeing up the resources to spend the time to go outside of your usual comfort level, right? Where you're usually going to work with these other folks.
Yeah, I really appreciate you bringing up the choices around resources, because it sometimes seems like resources are the constraint, but really I'm hearing from you, there can be a view of looking at these resources as abundant if we invest them in ways that build wider relationships, right? And the relational aspect of this is coming through really clearly. One of the questions from our audience is posing a question about how does this commitment to relational work sort of connect with what is often a norm in science or health science to prioritize detached objectivity, right? Is this work of community engaged narrative, focus on value? How does that live alongside these norms of detached objectivity and scientific neutrality? What are your answers to that kind of constraint?
Well, I certainly feel that science tells us that racism, for example, white supremacy in this country, has had an incredible impact, destructive impact on people of color and white people. That's good science. That's not bias. That's not bringing in something it's an objective fact that income inequality, structured income inequality, right? That social determinants of health. God bless social epidemiology department at Harvard, has said that these are objective facts, and as people who care about better health or about human beings, we have the science behind us to fight to change the political and social and economic structures to attack, for example, racial segregation or mass incarceration, objectively and passionately, not dispassionately, but objectively and passionately, because the science, I think, is on our side.
Yeah, this is a great question, and this is something I've struggled with a lot and have a lot of thinking, a lot of thoughts about. I mean, first, I would say that I came into this thinking that, like I said, that data was just going to solve our problems, and I quickly realized that wasn't the case, and that this distance, this objectivity that we try and show is really false. Like, we all actually have values. Even as scientists, we have values, and those influence the research questions that we ask, the answers that we get, how we view the world, how we present the results, what research gets funded. All of those are based on values and our beliefs in the world. And so I don't think that in the end that there really is this sense of objectivity, that it really is true. It's a false narrative. At the same time, I think that public health departments can take advantage of that narrative in some sense. They validate what the concerns of the community are by putting it into scientific language or into scientific reports. And so often I would say the groups that we were working with, community organizing groups, are viewed as political, viewed as biased. But then we could come in and do a report with them and do a health impact assessment or whatever it is and present the data in such a way that we're collecting that same data through focus groups, through our scientific methodology, but we're presenting it in a way that is more palatable to decision makers. And so we can take advantage of this perception that public health is more objective and present data in that kind of way that may sway a certain group of people. So there's a lot around this.
And I would add one thing to Jonathan's very good description, which is that we have to be careful of what we consider objective knowledge, right? It's not simply something that comes out of the, quote, scientific process or expert knowledge. Folks at the base, folks in the community, what is sometimes called tacit knowledge, experiential knowledge, is absolutely crucial to all the work we do. It's crucial in public health. It's crucial in every area of organizing work I've ever done. And as many studies have shown, it's actually crucial on the production line. That workers on a production line often know more than the managers do about how to do it. So the notion of what is objective knowledge, I don't think this is controversial at this point, but needs to be said over and over again. there's all kinds of knowledge that we need to bring into this, and the knowledge of the people at the base, the people who are directly involved in what's going on, is a crucial piece of that puzzle.
Yeah, it's I'm hearing again the line that Tony began this workshop with, that the health arena is often very involved with an understanding of itself as a technocratic enterprise. But what I'm hearing from both of you and what we've seen is, at the end, it is a democratic enterprise. And you know, we've got truisms that have hard-won lessons that travel under slogans like "nothing for us without us." Right? This has been the watchword of the quality improvement movement. This is the watchword of quality improvement in industry as well as in healthcare. So let's talk a little bit about how to and under what circumstances is it possible to engage more and more people in a joint and sort of orchestrated enterprise to establish those conditions that everybody needs to thrive, with no exceptions, right? How do we involve so many people in an enterprise if we're not just relying on, quote, the experts and the institutions to do it themselves? Where does that thirst for engagement, and how can it be orchestrated so that we're not just following the lead of what a funder or an organization says is the issue or the opportunity for action?
One reason that the powers that be, whoever they may be in any circumstances, don't like organized people is if you give people a sense of what they can do when they're organized, they might want more, right? It might expand, it might get larger, which is very dangerous. Democracy is actually a very dangerous thing if it's taken seriously. It's hard to do. It's hard to make democracy make sense to people if they don't have the power to make it real, right?
But let's go slow here. Dangerous to whom?
Well, so
or in what way?
As people know, the founders of this country, among their many weaknesses, was that they were actually afraid of democracy. They tried to have a relatively weak government because democracy might mean that property is shared, that white supremacy is overturned, that people actually speak for themselves, and as they work together, realize what their larger self-interests are. So that's the attempt on the part of many political forces now to disenfranchise people because they don't want to see democracy at work. But to involve people, to go back to your question, Bobby, people are isolated, often feel like they have no power, and in some sense they don't. It is when they get organized, when the Latasha Browns and the Ajin Poos come along and bring them into larger structures, that they start to say, oh, it makes sense to be part of the public sphere. It makes sense to be engaged, right? As an isolated individual, it's hard to see what difference I make, but oh, I'm part of the domestic workers. I'm following Stacey Abrams. All right, then I will participate and do things. And investing in that, expanding that is both what makes people get more and more involved and makes it, successful, but we have to keep building on it. Have to keep investing in it and investing in honest to God, down home organizing so that local people see their stake in it and get something back for it.
I'll let it sit with what Richard said. I think that's exactly right.
So you spoke about infrastructure, right? The ability for people to join into a process that actually is built to on premises of being relational as opposed to observational or engaged instead of technocratic. Let's talk about what you've seen in the evolution of that infrastructure. Clearly, it's not weak. It's not strong at the moment. It's not the norm. But how might you characterize any of the sort of looking back over the sweep of time, the evolution of both the centering of this as an important issue and the infrastructure to make it more routine? Do you see signs of progress in that or not?
There's been enormous progress. It's having watched sort of the birth of modern community organizing in the early 1970s, and when I was in Chicago, in those days, community organizing literally was kind of a competitive gang place. Community organizers groups attacked each other. The thought of community organizations across Chicago working together it was inconceivable. They rated each other. They told funders to stop funding each other. Those were the bad old days, right? Those were the early days, right? Sort of single cell organisms attacking each other for resources, for people and money, as it were. So we've come an enormous way in those years, right? Building an infrastructure, meaning national networks of community organizations, ties between community organizations and trade unions and religious institutions and civic institutions. But it is, at this point, completely insufficient. It's only in the last few years that the kind of community groups that we're talking about, community organizations, have gotten seriously involved in electoral politics. And you know, you only have to look at what Latasha has done and Stacey Abrams and other Black women have done in Georgia to see that move from the anti-political notions of the 1970s in community organizing to this extraordinary relationship to electoral politics, understanding electoral politics as another arena of power, which is legitimate to go into, right? How you expand the definition of power matters to what you do, has been crucial. So it's exciting to have seen the changes, but let me give you one place where we still lack that. We talked about narrative several times now in the last hour and a half. And yet across all these institutions of public health, of worker organizing, community organizing, low income people in organizing, housing organizing, unemployed organizing, there is in fact still no shared narrative about race, about gender, about the role of capitalist institutions and neoliberalism, about individualism, white supremacy. So we're now talking about narrative, and we know there should be something unified that deals with these big issues, but we don't have any place where that is still generating that in a way that we sound like we're part of the same thing, that we across all these institutions, right? All the folks who are listening to this webinar today, this conference, can say, oh, if I talk to my neighbors, I have some idea what to say, and I'm saying the same thing in Topeka, Kansas, as you're saying in Boston, as I'm saying in Berkeley, California. We have a shared narrative. We know bits and pieces of it. We know white supremacy is a key piece of it. We know kind of capitalist dog-eat-dog competition is, we're against that. But we've got a long ways to go still. We really have to fight to sort of think in bigger terms, I think.
Yeah, and building off of that piece around narrative, completely agree. And you know, things I've learned from you, Richard, and others. If you look at current narratives, the neoliberal narratives, and how they became dominant here, it's because the right was able to build such amazing infrastructure. You look at the coming together of the religious right with the corporate right. And the power that brought in advancing neoliberalism and a set of narratives. We have nothing like that on the left yet. It's going to take much more infrastructure to get us there. And we are seeing pieces of it. There are new formations that are forming. One of the things I'm doing now is facilitating a group of kind of alternative worker organizing, non-union worker organizing groups that have come together around COVID and this essential worker frame. iGen was part of bringing this group together. So those kinds of infrastructure pieces are coming and sometimes going on the left, but we certainly need to strengthen them. And the last thing I'll say around this is that there is a role for health in all of this too. It's not just organizing groups that need to be part of that infrastructure, but it's government and it's other institutions as well. And public health agencies, others in health, hospitals have relationships with other institutions and with individuals that they can bring into this growing infrastructure as well. And one of the reasons why organizers are excited about working with public health agencies or others is that they have those relationships with a planning department or a public works department or whoever else is in government or in other institutions, and can bring those relationships into the joint work and give access to those relationships to the community organizing groups, which helps them, again, build their power through building infrastructure.
I'm glad you mentioned COVID. Several of our audience members have asked questions sort of about the insights that are becoming revealed in this moment of crisis. And I'll just weave a few of these together. There is partly the sort of pattern of underfunding of population health and community health relative to healthcare. And so sometimes we often see the social context and the interdependency of our lives only in a crisis. Others, the sort of presence of organizations that have long been working for dignity and inclusion and to establish conditions for all people are sort of in the blind spot of institutions. And so when in a crisis, there can often be a flocking of resources. The hospitals and public health partners don't even know that in their own neighborhoods are decades-long community groups that have been pursuing this work with resilience every day. And then on top of it, another questioner, I'm sort of packaging these together as all elements of the moment. We're not just dealing with sort of neutral narrative and how do we speak into this? There is disinformation, targeted information that is actually tearing at people's sense of belonging and connection and dignity. And so how do you see the possibilities of actually getting into right relationship around a lot of these issues as we spring forward from these crises to convert loss into a new kind of renewal of civic life?
Jonathan, why don't you jump in on that? Because that's really at the heart of your work.
Yeah. Yes, I mean, I would say that a lot of the dominant narratives have led us to where we are, right? So there's one of the dominant narratives is, currently is around the fact that government can't do anything right, that really free markets are what we need to solve our problems and that we should be shrinking government. Well, that's led to us being completely unprepared for a public health crisis because we've underfunded public health for decades now. Another component of the narrative is around individualism, that we can just pull ourselves up by our bootstraps. Clearly, addressing COVID is a collective issue. Like my health is directly intertwined with everybody else's health, and it's very dramatically shown through this pandemic. But our responses are still grounded in a lot of those. The fact that people are just being told to take care of themselves, stay home, and we're not seeing collective responses like paid sick days, for example. Right. This is a policy that is common sense and could help control the pandemic. But because we're still in this individualistic mindset, we're not saying, well, corporations really should be giving people paid sick days. So those narratives really need to change. And I think that we're seeing some of that. A lot of the message of we're all in this together, kind of a belonging, we're stronger together is coming through among, some people talking about this, clearly not everybody. And I think the crisis has revealed just how badly prepared we are and that corporations don't have all the answers and that we actually need a collective response that is in the form of our government. And we need to improve government. It's failed so many people for so many decades and centuries really, but that it is our collective response, and COVID has just revealed that in a pretty dramatic way. We do, as Richard was saying, need to consolidate on a narrative that the left can tell, that is compelling and comes from the base, and I think we're seeing some germination of that through this, but I don't think we're anywhere close to where we need to be to actually be prepared, for example, for the next public health crisis we're going to face.
Yeah, just let me take one example of what we're not still quite ready to take on, some of the holy of holies. So in California, I live in California now, and we have what looked to be a good public health system, good hospitals, good health care. But it turned out that over the last 20 years, hospitals had been shedding hospital beds, to save money. profitability and resources and disinvestment. And this is taken for granted. Groups, I mean, the question of profitability, right, even in a nonprofit setting of resources, is in the dominant narrative common sense. It turns out that not having redundancy, not having buffers, not having resilience in our healthcare system, not investing in it for the long tail probability events, which will happen, right, has been bad. But can we lift that lesson up among the lessons of COVID-19? Right? Can we lift up the fact that tying health to profitability, right, has incredible downsides? It's not smart. It's not efficient. It looks like it in the short term. It looks like it from the point of view of the dominant narrative. But in fact, it's stupid to do it in terms of human beings. Let's come back, as Latasha Brown says, let's come back to human beings. It's stupid, and we have to find another criteria for how we deal with health.
You know, we have very little time left, just a couple more minutes, but I'm also mindful that the recent release of the Surgeon General's report on community health and economic prosperity, almost making the same point that we need healthy communities to be prosperous economically, and we need an inclusive economy in order for us all to be healthy. And that without the two, we really can get into a severe spiral, but those two can work in tandem in a virtuous way to really unlock potentials for greater health and economic prosperity simultaneously. And you know, with more time, we probably can unpack the language of left and right, because what I'm not hearing you say that this is only a, you know, sort of red-blue partisan divide. There are elements of real unifying aspect to this. And I'll just end with one question. A recent Harvard Business Review paper showed that 9 out of 10 Americans would be willing to take less money in order to do more meaningful work. And I'm wondering what that says to you, that signal that there's a thirst for people to do not just the private paycheck, not the shortcut that gets me, the resources for my own family, but a thirst to do something bigger. And I would just leave you with the last words on what do you see in that signal, which is unifying across American, society, that we want to be part of something bigger.
I deeply believe that when we talk with people in small groups quietly about issues that matter to them, such as the meaningfulness of work, the question of right and left tends to evaporate. I've had many discussions like that around the country, rural areas, white groups, predominantly white folks, talking about healthcare and talking about over the course of an hour or two, people saying around healthcare, I don't really want someone to make money, cut wages of people who are taking care of my family. I don't want to make money over somebody living or dying. There's something sort of wrong with thinking about profit and loss in healthcare. Healthcare plays a privileged role, I think, a special role in this way, but it means talking in very human terms. And not in such political terms.
I'll say I'd made that choice 15 years ago. Like I said, I was in biotech. I was getting paid a whole lot more from in that world than I was in the nonprofit world. And frankly, it was absolutely the best decision of my life. It actually gave meaning to my life, and I'm a much happier overall person than I could have ever been. So it's the right thing to do. More broadly, I would say, the future of work in this country is something that's changing, right? There's a lot of automation. We're seeing we're seeing companies like Amazon surveilling their workers. There's a whole lot of bad stuff that could be happening, that is happening, and could continue to happen unless some of these narrative changes happen around what is allowed. I think this whole question of whether income should be driving all of our decisions is also one of these narrative questions. and it goes back to this question of what we value and whether we value people or just money. Those kinds of things have to really shift if we're going to get to the kind of world in which everyone can thrive, which is, I think, what we're really driving towards.
Well, thank you both. Judging from the questions that have surfaced in the chat, you have definitely sparked people's thinking and imagination. There's way more aspect of this, and the good news is there's more to come, even in this workshop, as we think about sort of the grand transition from decades of building an adversity economy to ones that can unlock our economy around well-being and inclusion for all. The rest of the program has an hour-long break, and then we'll start again at 1. So thanks to both of you for your time and your wisdom and your daily work, and to everyone in the audience for being with us, and we will reconvene the workshop at 1 o'clock.